Today we work through ethnographic case studies from Scott Stonington's The Spirit Ambulance, about how people die in northern Thailand. I titled this lecture, The Ethical Constellation, deliberately. Western bioethics thinks of dying as something that happens to a single, bounded individual. Stonington shows us a world where dying is a collective event, multiple beings entangled through karma. The self at the end of life is not a single star, but a cluster of interconnected elements. Let us begin with a scene. Arirat is dying of pancreatic cancer at Nakhon Ping Hospital in Chiang Mai. She has declined surgery, chemotherapy, and all pain medications. Stonington, both anthropologist and physician, is at her bedside when she is seized by convulsive pain. He and Nurse Ampha hold her down physically, because that is what Arirat demands. Look at the quote on this slide. When Stonington pleads with her to take morphine, she says, "I need to focus. You are having a problem with this. For me, it is an opportunity. I need to study." The Thai word is vicharana, to investigate, to contemplate. She is using pain as a meditative object. A dying woman insisting that unbearable suffering is a research opportunity. Note also the class dimension. Arirat is middle class, in a private room. In Thailand, wealth and spiritual attainment are connected through karma. Keep that in mind. Here is Arirat's key distinction. Chep is physical pain. Thuk Thoraman is suffering. They are not the same. Mindfulness, sati, sometimes increases her pain, because she is so aware of every sensation. But it always decreases her suffering. And the paradox, morphine decreases her pain, but increases her suffering, because it clouds the clarity she needs to meditate. In Western biomedicine, pain is the problem, and eliminating pain is the goal. For Arirat, eliminating pain would destroy her ability to study the connection between heart, mind, and body before she dies. After that convulsive episode, she tells Stonington it was so interesting. She learned something new. Tom Tame interprets this as approaching freedom from suffering in this lifetime. This connects to the concept of level of mind, radap chit. Arirat is described as having a high level of mind, enabling her to receive and use the truth of her diagnosis. Most patients in Stonington's fieldwork were never told their diagnosis at all. Now, how does Arirat conceptualize her tumor? She calls it a chao kam nai wen, a karma master. The slide breaks down the term. Chao nai is owner or master. Wen is paying back. Kam is karma. A karma master is a sentient being from your past that has come forward to settle an old grievance. Arirat's tumor is not just tissue. It is a being she once harmed, now manifesting physically inside her pancreas. She describes the tumor as an angry little dog. It is suffering, and believes its suffering is her fault. So she cannot fight it. Anger would make it grow. Instead, she sends loving kindness, metta, and asks its forgiveness. Disease is not invasion. It is relationship. Second case, Mahu, a former buffalo farmer with intestinal disease and a colostomy. Stonington asks how he copes with the pain, expecting meditation technique. Instead, Mahu explains his disease is his karma master, the buffaloes he spent his life controlling. The parallels are concrete. The oxygen tube in his nose is like a buffalo's yoke ring. The nasogastric tube pulls on him like he used to pull on buffaloes. His legs are bowed as if permanently astride a buffalo. Look at the diagram. The biomedical equipment is not just medical technology. It is the vehicle through which the buffalo karma master interacts with Mahu. The buffalo has become part of his body and the material world around him. Stonington tells us, everyone he followed identified their disease as a karma master. This is not a fringe belief, it is a shared framework. Third case, Chonawad, paralyzed left arm after a motorcycle accident. He starts his story not with the crash, but with his teenage years. Wild, reckless, taking street dogs onto his motorcycle for sport. One day he drops a dog. It skids along the pavement, breaks its leg, disappears. Years later, riding through fog, a dog bolts from the woods. He swerves, crashes, destroys his arm, lies all night hearing dogs bark in the distance. The dog, he says, is a karma master. It came back to resolve the karma. Now it is in his arm. Sometimes it chews from the outside in dreams, but mostly it chews from the inside, like my arm is part dog. Yet his response is not despair. When the pain is bad, he sends loving kindness to his dog arm and asks forgiveness. Actions weave forward through time to alter the material present. Now for the conceptual work, the theoretical heart of this lecture. Western bioethics assumes a bounded individual, one person, one body, one mind, one set of autonomous decisions. Stonington's cases reveal what scholars call partible and distributed personhood. The self is a temporary composite, parental blood, animating spirits called kwan, moral objects, and karma masters fused into your body. A fourth patient, Thought, who had mild schizophrenia, explained that the disturbing thoughts in his mind were a karma master from killing a man in a past life. When asked if the thoughts were his or the dead man's, thought said, "My heart-mind is not really my own anyway." Non-self, impermanence. It does not matter whose ideas they are. If the patient is not a single bounded person, who is the subject of care? Who gives consent? Who is dying? Two paradigms side by side. Left column, the Enlightenment approach. Bounded self, disease as invader, pain as signal to manage, healing through chemical and surgical intervention. Right column, the new end-of-life Thai approach. Partible self, disease as karma master to face, pain as object of study, healing through forgiveness and loving kindness. Neither is right or wrong. But bioethics, built entirely on the left column, cannot even see the ethical concerns of people in the right column. If your framework assumes a single autonomous patient, you have no tools for someone whose tumor is a sentient being. The concept of tit, stickiness, is the mechanism binding beings across time. Every action creates residue that sticks to those involved. After Fong's death, her daughter Nin feels her mother's presence, doors moving, cups falling. At first, she is comforted, but then she realizes wanting her mother to stay is itself stickiness. She is not my mother, because she has changed. Wanting her around will stick to her, and stick to me too. It will harm us both. So Nin forgives herself for clinging, sends loving kindness, and lets go. In this framework, that is not just emotional advice, it is an ethical imperative with metaphysical consequences. Clinging changes the composition of both beings. If the self is a constellation, then choreographing a good death means managing what is literally in the room. Moral objects are assembled at the head of the bed. Amulets, statues, cash, not to take into the next life, but as objects infused with ethical residue that confer goodness through contact. If the hospital is full of polluted spirits, escape. Bring the person home, where the space contains better characters. Fill the room with good people. Do not shatter the dying person's kamlangchai, heart strength, with dark news. You cannot control all components, so the choreography also transforms harmful elements into benevolent ones, exactly what Arirat does when she sends metta to her tumor. The practical steps of resolving karma. Acknowledge the karma master, radiate metta, ask for and grant forgiveness through the ahosikam ceremony, detach the karmic thread. Fong's forgiveness ceremony. Each child takes a silver platter adorned with flowers, bows over her chest, and asks forgiveness for specific wrongs. A son gone to Bangkok too long, a daughter who fought with siblings. The requests must be genuine. If Fong cannot truly forgive, the grievance sticks, and she might become a karma master herself, returning to harm her family. The family systematically goes through everything that might stick and tries to release it. This is not metaphor. It is a structured technology for producing a good death. Stonington's most provocative concept. If a person is a temporary constellation of blood, spirits, and karmic debts, then dying is not the failure of a machine. It is the disassembly of a collective. So healing at the end of life cannot mean just fixing the body. It must mean resolving the relational wounds between all the distributed parts before they disperse. A non-relational model says cut out the tumor. A relational model says the tumor is a being with its own suffering. Healing means loving it and releasing the bond. For reflection, does Western bioethics have any framework for a patient who says, "My tumor is a sentient being and I need to love it"? If not, what does that tell us about the limits of autonomy-based ethics?